My name is Kelly Anderson. I'm an RN. I'm a nurse educator here at Mercy General, and today we're going to go through the discharge instructions from the surgeon. Okay, today we're going to talk about all the guidelines for recovery so that the patient has a nice healing and everything is successful as you transition home. We're going to talk about the walking program. We're going to talk about the showering guidelines. We're going to talk about step-by-step how to take a shower. We're going to go over medications. We'll go over a little bit about diet towards the end, kind of eating to heal. So we're going to go through this together. Feel free to ask questions as we go, and we're going to go through the paperwork together. You don't have to take notes. Everything is written down. We also have videos in the room that you can watch and ask the staff here to bring that video in or on the TV when you're ready, okay? So if you look in the book, there's lots of good handouts that we give you. When the patient's discharged home, the room nurse will go over all the medications for the patient, okay? And so those are the medications that the patient is to follow. They'll give you a list, they'll give you more paperwork. This is a general class, okay? So if you have any questions about medications, feel free to ask before you go home. If you go home, call the cardiologist or the surgeon after you go home if you have questions. We give you a medication card. You can keep this in your wallet, in your purse. It's a good idea to have a list of your medications with you at all times, okay, so that you can pull that out if something arises, okay? We also have in here a handout that is patient education about dietary supplements. It looks like a grid. If the patient was on any supplements, herbals, vitamins, any over-the-counter medications, do not resume those unless you talk with your doctor first, okay? This is just a short list. There's lots of different things people can be on, but please ask. Sometimes they'll have the patient wait a month or two before resuming supplements, and so do get that cleared by the doctor, okay? You'll see garlic and ginger on that list. That is in a tablet form. It's okay to cook with garlic and ginger, so don't worry about that. Here at Mercy General Hospital, we do offer a cardiac diet class. That's open for anybody. We talk a little bit about diet today, but not extensively, so please do follow up and take some extra classes. This is free. Call that number if you want to sign up. If you have Kaiser insurance, they have a lot of good classes you can do through Kaiser, and you'll get information on that at your discharge. Here at Mercy General, we have a cardiac rehab program. We have this downstairs. Cardiac rehab is an exercise program the patient can join that starts about 5-6 weeks after they go home. It is covered by the insurance, and you come to the department and you exercise about an hour, 2 to 3 days a week, and it helps you get back in shape. Okay, so I would definitely recommend cardiac rehab for everyone. If you do have Kaiser insurance, they have their own program called MultiFit, so do participate in that also, and that starts at about 5-6 weeks, okay? And that's that handout. Now we have another handout. It is the shopping list. And so family, if you can take this, get a look at it. There are some things that we want you to have ahead for the patient. So we do recommend a stack of washcloths, just some small washcloths. If you're going to buy the washcloths ahead, I would recommend white washcloths. You can get a stack of them from Walmart or Costco or something like that. Wash them ahead just like you normally launder. If you have washcloths at home that you've already washed a lot of times and they're colored, that's fine. Just use those. Each day we're going to need a clean stack of washcloths for the washing, okay? Now we want the patient to use a liquid soap or a body wash to clean the incisions, and that's really important. We want it to be in a bottle, liquid soap, so when it comes out of the bottle, it's super clean, okay? We don't want bars of soap that can hold mold from the shower. We don't want antibacterial soap. We just want a body wash. It can be Dove, Caress, Walmart's brand, Target's brand, just a body wash, okay? So we want to get that. A scale, a blood pressure machine, and a shower chair. We do recommend a shower chair for everybody for a couple weeks after they go home. A shower chair, it's a plastic bench seat with legs with rubber stoppers so it doesn't move around in the shower. don't spend too much money on this. You could borrow a shower chair. You can get it from Goodwill. You can get it from the hardware store, Walmart, some of the hospice or different places, church, whatnot. Get a shower chair and have that ready for the patient. Make sure it fits in the shower properly, okay? And then a walker. A lot of times the insurance does cover walkers. Do look into that with your nurse or your doctor, whether the patient needs a walker or not. Okay, and so it is nice to have a walker available if the patient is weak. It's nice to have the ones with the little chairs, the little seats in there, but often those aren't covered by the insurance. So if you could borrow one from a friend, those are nice to take a little rest if you're doing your walk. Okay, so that's the shopping list. And then there is a vital sign log list to keep track of the vitals as you go home. And this will give information for the patient to give to the doctor as needed. Okay, so what we're going to talk about now is this booklet. Okay, so pull this booklet out. What we're going to do is go through this booklet page by page. So I am going to point out some pages as we do our talk. So first of all, if the patient has a large scar here, they went through the sternum, through the breastbone, through the chest bone to get to the heart. Okay, so you'll see a scar here. So during surgery, they open the chest to work on the heart. When they're done with surgery, they bring that chest back together, and they want that bone to touch. Okay, then they put wires, stainless steel wires in the chest, or they'll put plates in the chest to hold that sternum together for healing purposes. The bone and tissue heal around those wires or plates. That bone the bone will heal, the wires and the plates stay there forever, okay? Now the key here is to not break the wires during the healing process and make sure that it doesn't pull apart, okay? So there are some guidelines and rules that we want the patient to follow, okay? So keep in mind for the patient that you will have this on your medical history as you go for other tests, procedures. If you were to go through the airport metal detector, you would beep. You got metal in your body, kind of like what you would if you had a knee replacement or something. So keep that in mind, okay? They say sometimes after about 6 months it may not trigger those alarms, and it's not harmful to go through those detectors and stuff, okay? So turn to page 2. And page 2 starts the discharge instructions from your surgeon, okay? And so it is very important to follow these guidelines for 12 weeks, and we're going to go through this together. So number 1, do not lift anything 10 pounds or more for 12 weeks from surgery date, okay? Do not do strenuous arm motions. We don't want to do repetitive arm motions that may pull the sternum apart or possibly break a wire, okay? So we don't want to do the raking, the mowing, the digging, the pruning, anything that's going to bring the chest apart, or even the vacuuming where you're back and forth, okay? We don't want to do vigorous mopping or doing the windows or any repetitive motion where you're back and forth and pulling and tugging, okay? We also don't want you to do certain sports. Obviously, golf, tennis, or bowling are off the list, okay? Because you have a weight in your hand, it's kind of obvious, but we don't want to do that for at least 12 weeks, okay? So a gallon of full milk is about 10 pounds, so we're not going to lift that until 12 weeks, that heaviness. Family, you guys may need to weigh things for the patient and make sure that they're not 10 pounds, because oftentimes we forget, the patient will forget and just grab something. And we want to make sure that it's not above our weight restriction, okay? Now, if you lift anything during this time, we want it to be between shoulder and knee height. So if the patient's lifting, it's all out in front. So the patient can lift 2 pounds, 5 pounds, 7 pounds. That's fine, but just keep it all out in front, okay? So it's fine for the patient to get in their fridge. They may want to just do like a quart or a half gallon of juice or milk or something like that. I do recommend for family, you guys put more stuff on their kitchen counter for 12 weeks if you can, the cups, the plates, and everything, so they can get around their kitchen on their own, and they can certainly wash the plate, dry it, and put it back in their stack and kind of move around on their own, okay? We don't want to lift a big pot of water, but they could do the saucepans and smaller stuff, okay? So we're going to talk more about activities further in the book. Number 2, do not drive a car. It's about 4 to 6 weeks that the patient should not be driving. It will be the surgeon usually that will release them to drive. Okay. In the meantime, we would like the patient in the back seat of a 4-door car away from an airbag should that deploy and hit you in the chest. Okay. It must have happened to somebody somewhere. Okay. So preferably back seat. If you have a 2-door car or a truck, just sit in the front seat. Move your chair away from the dashboard, maybe lean back. Okay. Regardless of where the patient sits in the car, we want them to wear their pillow on their chest and do the seatbelt in over the pillow, okay? So if they stop suddenly, it's not going to jolt them, okay? And so wear that pillow. The patient will kind of hang out with that pillow for about a month. You guys remind them, where's your pillow, okay? Use it to cough, sneeze, hiccup, laugh to support the chest. If for some reason they do not have their pillow, they can cross their arms over their chest and go ahead and cough in that, okay? Try not to just push on the chest directly, okay? We also want to think about how the patient gets in and out of the chair, in and out of the car, in and out of bed, and whatnot, so that they're not pushing all their weight on their arms, okay? So practice this before you go home, and as you are getting out of the car, we do not want you to grab a hold of something and pull yourself out. So concentrate on using the legs only. In the chair, if someone is sitting way back, we want the patient to kind of scooch to the edge, right? You're going to scooch to the edge, get your feet underneath you. The patient can use their walker for balance, or a family member, they can hold on to your arms. They could hold on here gently, and then feet underneath, lean over, and then get up. Easy, okay? Now, in the car, again, just concentrate on the legs. You might want to have the patient think about where they're going to sit at home, that they can get out of the chair, they can get out of the car. Sometimes I recommend getting a firm cushion or pillow in the seat of the car so it's easier to get out, or maybe at home so they can get out easier. Same thing with the toilet. Maybe you need a little riser for the toilet to make it easy for them to move around, okay? Now, when they get home, they can sleep in their bed however they're comfortable, okay? So they can sleep on their back if they want. If you decide to sleep on the back, just put some pillows in the bed so you're raised up a little bit. It'll be a little easier to get out of bed. If you're on your back, you don't have to sleep on your back for 12 weeks, but if you're on your back, to get out of bed, we don't want you to come up like a sit-up. We want you to roll to your side so the patient can maneuver, get on their side, use your elbows into the bed, and push up and sit up, okay? Now, it's very important to just sit up for a second before getting out of bed, because you get a little lightheaded, a little dizzy. We don't want to move fast. We do not want the patient to fall, right? And so the legs will come out. Family, if you want to help them get out of bed, just kind of help move their torso, that's fine. Now, the patient can lay on their side when they get home. You can lay on your side. If you want, try sleep with that hug pillow right on your chest, maybe a pillow between your knees. Sometimes people like those body pillows, are real comfortable, and that's fine too. Some people will even sleep in their recliner for a week. That's fine too, okay? All right. All right, now number 3, there is clean the incisions every day. We are going to talk about that, and I want to move to page 4 briefly, and then it's all diagrammed on page 5 for the showering instructions. But go to page 4, home activity guidelines. What patients tell me most is that they get tired from the surgery. Fatigue, tiredness. So I want the patient to think about pacing themselves throughout the day as they get home, okay? So I want you to think about, you do an activity, rest 30 to 60 minutes, do an activity, rest 30 to 60 minutes, and pace yourself throughout the day, okay? So an activity includes the walk, the shower, having visitors is an activity. So definitely rest before and after visitors. And then the showering's an activity. We talked about the walk is an activity, and the meals are an activity. So rest before and after these activities. It also says on this page to avoid extreme environment. If it's really cold outside or really hot outside, no, that's not the time to do the walk. So make sure it's a moderate temperature for when you do the walk outside, okay? It says to conserve energy. You know, with the patient, make sure you sit down to brush your teeth. Have a chair at the sink to do your teeth and wash your face and hair and things, okay? Same thing in the kitchen. Have a chair in the kitchen so that you can conserve some energy, okay? All right, now page 5 is the showering instructions. I want to go through the step-by-step showering instructions, you guys. It's all written down, okay? Now for the first week, we want standby assistance in the shower room with the patient. So someone in there, hey, are you okay? Do you need help? Can I help, okay? And make sure they're okay for at least the first week, okay? Now the patient's sitting on their shower chair and they are facing the water, and the water is spraying all over you, okay, directly. Okay, now it says here, number 2, lukewarm water, 100 degrees, not real hot shower. 100's pretty hot. You don't have to measure the temperature, but not really hot, because it can make the patient feel a little lightheaded and a little faint. Maybe have the fan on, the window open, okay? Now, wash the hair and face first. Yes, the patient can wash their own hair if they like. The hair is optional if you want to wash it or not, but the patient, just get a little bit of shampoo on there. You're reaching up close and you're washing your hair, okay? And then rinse your hair, wash your face, have this all done. So wash hair, face, rinse, okay? Now if you have a helper, a family member to help out, that's wonderful, okay? Then we're going to wash the incisions. So number 5, there it says, please use liquid soap or body wash, which we talked about earlier. Do not use antibacterial soap or soap bars, which can store mold from your shower. Okay, so you're going to use a clean washcloth for each incision. So I have a stack of washcloths ready for the shower. You're going to grab, the patient's going to grab the washcloth and get it all soapy, foamy, okay, with the soap. We want the patient to scrub gently the incision top to bottom, scrubbing gently. Okay, it should not hurt the patient. Usually they're numb in their chest, okay? If they have staples on their chest, we recommend a zigzag top to bottom. Okay, we want to get all that dead skin off there that kind of gets on the chest. Okay, so scrub it gently. Put that washcloth to the side, grab another washcloth, get it all soapy, and you're going to wash the chest tube holes. There's going to be these holes here, and there may be tape or steri strips on there. Okay, don't peel those off. Those will come off in about a week, and just wash over there. Wash, wash, wash. Okay, put that washcloth to the side. Guess what? We need another washcloth if we have another incision. So if you have an arm incision, same idea, get it all soapy, and you're going to scrub it gently. Put that to the side. If you have another incision on your leg, you're going to get another washcloth and scrub gently top to bottom. So just one washcloth per leg if both legs have incisions, okay? Then I want you to rinse, 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 rinse off, and then wash the rest of your body. Someone can help you with your back, your legs, your ankles, whatnot, and you wash off. If you want to stand up at the end of the shower and rinse off, that's fine. In the book, it does say to limit your shower to less than 10 minutes. So we definitely want to do that. Don't be in there a long time because you'll get tired, okay? Now, if your shower head disconnects, we prefer that you either leave it up there or a family member has to hand it to you. We don't want the patient like this, okay, doing this shower head thing. And or we don't want the patient to do a hair dryer like that. You can keep your arms in close, okay? They recommend when you get home that the arms just kind of go up this high and you keep them in close like that, okay? So when you're done with the shower, the patient's going to get out, sit on the toilet seat or a chair to dry off and get dressed to conserve energy. We want fresh, clean clothes every day. It is nice to wear button shirts that are easy to get on. You can certainly raise your hands up over your head to put a shirt on, but make sure it's nice and stretchy and easy to get on, okay? For the ladies, we do recommend a bra, a front closure bra with no underwire. Usually it's a size bigger, and that will help support the chest, okay? All right, so get that ahead if you can. With the pants, we do recommend like loose pants, shorts, sweatpants, pajama bottoms, so that it's loose and airy, okay? So we want you to use the washcloths for 4 weeks, okay? So just to repeat, hair and face first, rinse. Wash the incisions with a separate washcloth for each incision and rinse off, and then wash the rest of the body, rinse off, and then just pat yourself dry, okay? Clean clothes. Then go rest, okay? Any questions with the showering process? Okay, now go back to page 2, number 3. Now, in regards to the incisions or the cuts, I want you guys to watch them, okay? And it's a good idea for family, for patients to look at the incisions before you go home, so you have an idea of what they look like, okay? So you're not surprised when you get home. Was it like this before? Is this new? And so it's very common for the incision to be red right along the incision line. We don't want that redness to spread out. We don't want any drainage. If there's drainage or you need a dressing, that's unusual unless you were instructed to have a dressing from the hospital, okay? So if there's any changes, you do need to take note of that. It also says in here, do not apply lotions, powders, creams, oils, neosporin, betadine, hydroperoxide, anything on the incisions. Keep them clean and dry. You could put lotion on your arms or your back, that's fine, but we don't want anything on the incisions. Sometimes people get these ideas that they want the scar cream, the vitamin E. Don't put anything on there unless instructed by the surgeon's office, okay? All right. Number 4, do not swim, use a spa or a bathtub for 3 months. Okay, we don't want someone soaking in water, chlorine, trying to get out of a bathtub. Okay, so that's really important. Number 5 there says call the surgeon's office right away if there's any redness around the incision, pain, drainage, heat, or the sternum feels like it's unstable. So it is rare, but there are occasions where the wires break or they get separated. So if for some reason you feel like your sternum's moving or you hear a popping sound or something unusual in the chest, you're going to call the surgeon. And you're going to call today, not in 3 days, not in 4 days, but today. Okay, we're not going to wait. The surgeon's number here in our book is the cardiology, the surgeon from Mercy General, but Kaiser also has a surgeon, so they'll give you that number, okay? So call the surgeon if you have any questions. You'll see the surgeon in 2 to 3 weeks. You will also have a follow-up with the cardiologist in 2 to 3 weeks. Okay, so the cardiologist you're going to call if you have any questions about side effects to medications, if you have a fever of 100.5 or greater, or a weight gain. Okay, so those are other questions you may call the cardiologist, okay, after you get home. Now, number 8 says if you have diabetes, it's very important to keep your blood sugar under control. Okay? It's very common for your blood sugar to go up when you have a surgery or your body's under stress, but we do want to keep track of that. Okay? So it says here in the book, if you have a number greater than 180 3 times in a row, go ahead and call the doctor. And you can call your primary care doctor or whichever doctor helps you with your diabetes. Number 9, weigh yourself every day. First thing in the morning after you get up, after you go to the bathroom and before breakfast, weigh yourself. Be consistent at the time. Now what we're looking for is rapid weight changes. If you gain 2 pounds in 2 days or 5 pounds in a week, that means you have probably some fluid retention. Go ahead and look at your legs, see if there's swelling there. Maybe you're having trouble breathing. If you can't lie flat in bed because of breathing purposes, you're going to call the doctor, the cardiologist. If you want pillows in your bed because it's comfortable, by all means, that's fine. Okay. All right. We're going to come back to the walking program. I want to skip down. This is page 3. Number 13 is to continue to use the breathing instrument. The incentive spirometer, we want the patient to continue using that for a couple weeks after they go home. So during surgery, they deflate the lungs, and now they're all open and working well, and we want to make sure that continues. And so that will encourage the patient to take deep breaths. Because what happens if someone is sore or uncomfortable, they tend to shallow breathe, and they don't fill the lungs full. So look at that dial and get that up to what you do in the hospital. We want you to do it 5 or 6 times throughout the day, 8 to 10 times each. So keep that up. You don't need to wake up in the middle of the night to do that machine. Okay. And then back up at number 10, just to mention with the swelling, is keep your legs elevated when you're not walking. Okay. So keep the legs up, especially if you have an incision on the leg. Keep it up in a recliner or lay on your couch, put the leg up on pillows, anything to kind of keep it elevated when you're not walking around, okay? If you have an arm incision, we do recommend you keep that up on a pillow too, and that's going to help the swelling, okay? All right, the other thing I'll mention real quick right now, and we'll talk about it a little more later, is to watch your salt intake or your sodium intake, because if you eat too much salt, it can hold on to fluid and cause more swelling and make you not feel so well. So in the book it does say about 1,500 milligrams of sodium a day. Okay, so really try for that. Okay, and we'll talk more about that in a minute. Number 14 on page 3, it talks about that it's going to hurt, okay? There's expected to have some pain or discomfort, okay? They did a big surgery, okay? And so we want the patient to continue their pain pills as they transition home. Your nurse will tell you what pain pills the doctor has ordered for you. Continue that as you transition, okay? And then slowly wean off the pain pills. But you can also use a heating pad or an ice pack on your chest, your back, your neck, whatever is sore, 20 minutes on, 20 minutes off. If you use a heating pad, just wrap it up in a pillowcase, and yeah, you can set it right there on your chest, okay? And that feels good. So if you think about what they did, they kind of, you know, move the chest open, the shoulders can be sore, the back can be sore, you know, being in this bed, you know, and that. So that would be expected, you guys. So, and number 15, you may be cold, okay? So oftentimes during surgery there's some blood loss, okay? They don't replace all that blood, but you may go home with a little low blood count or anemia. You can, you know, ask what your numbers are before you head home, but that can make you feel a little cold. It can also make you feel tired, okay? It takes about 4 to 6 weeks to make new red blood cells, and so the patient will be tired partly because they have some blood loss, and so they'll notice they'll kind of perk up at about 4 or 6 weeks, okay? So it's quite common for the patient to be tired, to take a nap here and there. That's quite normal. And then, like I said before, is to space out your activities as you're getting back to stuff, okay? Number 16, maintain proper posture. So, you know, just sitting up, having a good posture is going to help also, okay? Number 17, delay all routine dental appointments for 6 weeks, okay? We don't want you going to the dentist and mucking around with the teeth and stirring up bacteria. Now, if there's a dental emergency, you got a sore tooth or whatnot, go ahead and call the cardiologist and check in. They may have you do antibiotics before dental work or evaluate that. If you had your heart valve worked on, you will need antibiotics prior to every dental appointment forever, okay? So you can get that prescription from your cardiologist, and that would be for even a cleaning, okay? All right, how are you guys doing? So far, so good? Okay. All right, so go to page 6, and we're going to talk about the walking program. And that should have already started here in the hospital. And so we want the patient to walk every day during the recovery process. And this is what's really going to help them get stronger and get better, okay? So we do encourage that. And they're already walking here. So when the patient gets home, I recommend for the first week just walking in the house. Kind of get used to being at home, walk in the house. And I tell pretty much everybody to start off at 4 5-minute walks. And even with these walks, you're going to rest 30 to 60 minutes before the walk, okay? And space them throughout the day, okay? And time it. Okay, here I go for the walk. Okay, walking to the bathroom or the kitchen doesn't count as the walk, okay? So we want a walking time, okay?
A really long walk to the bathroom?
Yeah, that's possible, okay? You guys think about that, okay? So it depends on how far your bathroom is away. All right, so start off at 4 5-minute walks. Do that for a few days. See how you feel. See how the patient feels. If you feel good, then go to 4 6-minute walks. Do that for a few days. Hey, I feel pretty good. Go to 4 7-minute walks. Maybe you're tired, back off, go to a 5-minute walk. So kind of work with it until you get to 4 8-minute walks. That's about 32 minutes a day. So our goal is to start off at walking 20 minutes a day, build up to 30 minutes a day. That may take a couple weeks. Once you get to 4 8-minute walks, then you can go to 3 10-minute walks. Now, there are those people that start at 3 10-minute walks. That's fine. But it depends on the patient, okay? So do that for like maybe a week and then go to two 15-minute walks. Still 30 minutes, 32 minutes a day, but you get more endurance for each walk and they're a little longer, okay? Once you get to 2 15-minute walks, then you can do 2 16, 2 17, 2 18, 2 19, till you get to 2 20-minute walks. That would be wonderful to work up to 40 minutes a day. At about 5-6 weeks is when the cardiac rehab starts. Okay, and make sure you're signed up for that. It's nice if the patient's already walking at least 30 minutes a day is nice, okay? Now, there are those people that don't walk very well because of orthopedic reasons, okay? And so you might have to do more frequent walks, but smaller, that's fine. It's that moving. There are some people that could do possibly a sit-down bike. Okay, we do like to wait 4 weeks to do exercise equipment, and especially treadmills because it's a machine. Okay, so we do prefer the walking first. We do recommend doing cardiac rehab prior to returning to a gym if that's available to you. Okay. Now, after about a week, you can walk outside. When the patient goes outside to walk, make sure that it's not too hot or too cold. And then I want someone to go with the patient when they do the walk outside. Okay? So think about your time. Go away from your house 2-3 minutes, turn around and come back. Okay? Or maybe have a chair somewhere where you know you can sit and rest, or you take the walker with the seat, okay? So it's nice to have that available when you're walking outside. We do recommend that the walk is level for 2 weeks, okay? Now, the patient could walk at a track. They could walk at the grocery store week 2 if they want to get out of the house and go somewhere else. If they go to the grocery store, park at the front door and drop them off, and they can walk the aisles, but we recommend against pushing a grocery cart ideals for 12 weeks, okay? Just even if it's empty, because they tend to lean on it and maneuver it, okay? But they can walk the aisles, but stick to the time frame that you're at, okay? We don't want the patient walking a dog on a leash because of the pulling of a dog, okay? Any questions about the walking program? You know what sometimes I recommend is getting a whiteboard, you know, the little whiteboards you can get at the dollar store, and getting that and putting it up on the fridge, and then make a list of goals for the patient each day and put walking up there, kind of like what we do here, and you check it off. Did the walk, did the breathing machine, did the shower, okay? And I'm going to show you some exercises in a minute that we want the patient to do too, okay? All right. Very good. All right, I want to move to page 9, checking for symptoms of overexertion. Now, when we do the walk, we want it to be comfortable. You're not going to go super fast. Just at a comfortable pace. You should be able to talk while you're walking. But sometimes if we walk too fast or do stairs, we might get a little short of breath, okay? And just slow down, okay? I would expect that. Now, if for some reason the patient is short of breath sitting in a chair and they're not doing anything, that would be a 911 call if that's a sudden change, okay? Angina or angina is listed there next. That is chest pain that some people feel because of a decreased blood flow to the heart muscle. We don't expect that after a bypass surgery, okay? So if you're having the same pain you did prior to surgery and it feels like angina, maybe an elephant sitting on the chest, or you know, the vice or the pain, you need to call 911. Okay, that's not normal. Now, what is normal is to have pain in your chest after surgery. So if you touch your chest and you go, oh, that's sore, I take a deep breath, I'm sore, yeah, I would expect that. Now, a lot of times when someone has bypass surgery, they will take the internal mammary artery and use it for one of the bypass grafts. So what happens afterwards, the patient will be numb on that side. So they'll touch it and go, oh, I'm numb, you know. And I just tell people that in class so they'll be like, oh, okay, they said that. Might be numb, that's expected. Sometimes they get numbness down their arm. Again, that's expected, but do report it to the doctor, okay? Sometimes people feel little pokey pains through their chest, like sharp pains that come and go. Don't panic about those. That is just the healing process. If you have a sudden pain that stays, that could be a problem, and you're going to call the doctor or call 911, okay? You'll see listed here dizziness, fainting. Those are things to report into the doctor. If anyone's really symptomatic, don't hesitate to call an ambulance, okay? Heart palpitations. You know, this can happen after surgery where the heart races. And if it does it a little bit and it goes back to normal, you're going to call the cardiologist. If it does it and it doesn't stop, you need to go to the emergency room, okay? Nausea, sweating, these can happen. You know, these are things to let the cardiologist know about, okay? All right, go to page 10, sexual activity. All right, we want the patient to wait at least 2 weeks. Okay, some people wait the whole 12 weeks. That's up to you. Do read this in detail. The test is to climb 2 flights of stairs, no stopping, no shortness of breath. Then you know you're physically ready for that activity. Okay, don't lean on the arms. Okay, now if the patient takes Viagra, Levitra, or Cialis, it's very important to not resume those until you discuss it with the doctor. Sometimes patients go home on a medication called Imdur or isosorbide, especially if they had the arm incision. That does not mix with the Viagra and Cialis and Levitra, okay? All right. And I know we didn't talk about stairs. Does anyone have stairs at home? Stairs. It's not against the rules to do stairs. Now, what we ask is that when the patient does stairs, is that you just do a few stairs, stop and rest. Do a few stairs, stop and rest. If you have a whole flight of stairs, you're going to put a chair on the landing and the patient sits. Then you go to the second half, and it's a slow process. When you're done with the stairs, either at the top or the bottom, you're going to sit down and rest. Okay? You're not going to do stuff. Okay? All right. Now, page 11 and 12. Okay? These are exercises we want the patient to do at home once they get at home. Okay? There's 2 sides. I'd recommend pulling it out. Put it up on your refrigerator, and you can do them every time you do your walk, before or after, or figure out another time, okay? So I'm going to show you these right now. Now, the ankle circles are really nice. If you're in your chair, you got your feet up, you're just going to spin the ankles, and that helps decrease the swelling, okay? The arm side raises. You're just going to lift your arms up to shoulder height and then back down. And just do 4 times a day, and that helps strengthen the arms. People, they decrease their muscles pretty quick when they're in the hospital. If the patient had a pacemaker while they're here, there are restrictions to that side, so follow those restrictions, okay? Now the toe raises, I'm going to stand up and show you the toe raises. Hold on to the kitchen counter or the walker, and then just tippy toes. 5, easy. Hold on for balance, okay? Now on the back of this sheet, there are a few more exercises. Shoulder shrugs. Up. Okay, and that feels good. And then neck turns, just kind of turn the neck. And the last one shown there is leg side raise, side. And just 5 on each side, okay? All right, any questions? Yeah.
Can they start these while they're in the hospital, or does the patient need to wait till he gets home?
These exercises, they can start while they're in the hospital, and the nurse or the physical therapist can show them these exercises too. So anytime, okay? All right, the next few pages, 13 through 16, are activities what you can do when. So there are a lot of things the patients can do, okay? So when they get home, then that is the time frame for these things. They can have visitors. We recommend not a lot of visitors their first week, and kind of just space them out a little bit. And then they can do anything with their hands, the TV, the books, the computer, things like that. Load, unload dishwasher. They'll probably need help with meals initially. Week 2, they can kind of do a little more things. Remember to work between shoulder and knee height, around the house. Don't let them lift more than 10 pounds, okay? We recommend against doing, having them do the whole laundry, picking up the basket and all that, but the patient can fold clothes if they want. Nice and easy, okay? Does anyone have to go on a plane soon? They can fly after 3 to 5 weeks, but we do recommend they get cleared by the surgeon prior to leaving, okay? We just don't want anybody lifting luggage up over top and that. And I do recommend for the airport, even initially after your 3 months, is to go ahead and preload and have a wheelchair into the around the airport because they're so big. Okay? All right. Light gardening or watering 4 to 6 weeks. You can water with a hose. You can clip roses with your hands. A long car ride, 6 weeks. Stop every hour, get out, walk around. Okay? And so there's usually no restrictions after 12 weeks. If there's something the patient wants to do prior to 12 weeks, just talk with the surgeon about it, and they'll let the patient know if there's restrictions longer than 12 weeks, okay? Now, page 17 talks about cardiac risk factors. We're not going to go into depth on this, but it's very important to really think about factors that increase your risk of having heart disease, having valve disease. We want to stay healthy, okay? And so number 1 there, you'll see no smoking. If smoking is an issue for the patient, talk here with your nurse or your doctor and you can get some support on that. We do recommend against secondhand smoke also, okay? Page 18, cholesterol. You will probably go home on a cholesterol medication called a statin. They want to keep that nice and low. There are side effects to statins. Statins, simvastatin, which is Zocor, Lipitor, which is atorvastatin. We've got rosuvastatin, which is Crestor. These can sometimes cause all over body aches. And it feels like the flu. So if you have all over body aches and that's new and you're like, I'm not sick, you're going to let the doctor know. They can also cause a lot of GI symptoms, gas, bloating, stuff like that. But let your doctor know if you have any side effects to those medications. They want your blood pressure ideals 120/80 and below. Oftentimes, they will send the patient home on what we call a beta blocker, which is a medicine that keeps the heart rate down, the blood pressure down, like metoprolol, Lopressor, Toprol, Carvedilol, or Coreg. These medications also make the patient tired, and I like to warn people in class that you're tired from your surgery, but it could also be the medications. And they do say that you get used to the medications, but with these beta blockers, it's very important to let your doctor know if you have ongoing lightheadedness or extreme fatigue. We always recommend that the patient change positions slowly and don't get up quick because they'll get a little head rush and often feel off balance, and we don't want anyone to fall, okay? We talked about the high blood sugar affecting the healing process, so keeping that under control is very important. On the back, a sedentary lifestyle is definitely not recommended. Initially, as we're in the healing process, we want the patient to walk every day. And then otherwise, we want patients to walk 3 to 5 times a week doing the exercise for at least 30 minutes a day, okay? And then obesity, weight loss is helpful, but this is not the time to diet. We need all the calories the patient can get to heal, okay? That will come off as we go along in the recovery. And then stress management is very important, okay? And you guys can read that on your own. I want to flip over to page 23, coping with your emotions. I do like to bring this up during class because this is a very emotional time in someone's life, not only for the patient, but also with the family, okay? So it's common to go through an emotional healing as well as a physical healing as you're going through this and healing from surgery. And the family, you guys go right along with them with this, okay? So I do like to bring it up. The anesthesia stays in your system upwards of 3 to 4 weeks. And the anesthesia makes it so the patient may feel more emotional, okay? And that could just be from having the surgery also, but the patient can feel like they want to cry easy, burst out crying. That is very common. And I tell people, don't be surprised if you just cry, okay? That should pass, but that is common. You also go through these stages of healing, like numbness. Maybe you're in shock that you had to have surgery, or family, you guys are in shock too, huh? And denial or anger. So oftentimes the patient can get kind of hostile or agitated. Don't take it personal, and that should get better, okay? But they might not be themselves, okay? That's pretty common. Also, there is a little short-term memory loss that happens, so you get forgetful. Just remind them that should clear up too, okay? So that's common, okay? That first week at home, people tell me, man, that is the hardest week, okay? And so kind of hang in there. As people start seeing, hey, you know, I'm going to be okay, they'll start feeling better, okay? And the body will actually physically get better. But that first week, they can feel kind of down, sad, sorry for yourself, okay? And so that should pass, but if they get depressed or there are signs of depression at that bottom of that page, you need to let the doctor know, okay? This is not an easy time. It's not easy being a patient, and oftentimes the patients get frustrated because they can't lift more than 10 pounds. They have to ask for help, and so it's not easy, as well as for the caregiver, right? So you caregivers, you guys take breaks too, you know, and have people come in and give you a break and get out and do stuff. But I want you to think positive. You guys all get to go home. You got the surgery. You're doing well, okay? So think positive, okay? All right, the next page, 24, 25, medications for the cardiac patient. We really find that if we do education about the medications, it's more likely that the patient will take them. And so as the patient's in the hospital, they'll go over the medications every time they give the medication. We have a little bit about the medications here. The nurse will go over the medications specific to the patient on discharge. I do recommend family listen into that. The other one we like to talk about in class is aspirin. Okay, that's a blood thinner most people will go home on. Because it's a blood thinner, it will take longer to stop bleeding if you have a cut or something. So hold pressure for 2 minutes. Now, if anything anywhere is bleeding more than 10 minutes and hasn't stopped, you need to go to the ER, okay? But watch for signs of excessive bruising through your body or blood in your stool, blood in your urine, nose bleeds, ear bleeds, mouth bleeds, any bleeding, you're going to contact the doctor right away, okay? If there's dark tarry stool, there could still be blood in there, okay? So keep note of that, okay? All right, so we talked about beta blockers. We talked about statins. I want to talk about diuretics. That one is common, that someone goes home on a diuretic. That is a water pill to get rid of the excess fluid. That will make someone go to the restroom, okay? Diuretics are Lasix, Bumex, Diuryl, Zeroxolin. What can happen with these is they take water out. That can lower the blood pressure a little bit. So if it does take too much out, you could feel a little lightheaded. Again, check the blood pressure. Keep that log and let the doctor know if you have symptoms of lightheadedness, fatigue. Sometimes they take too many electrolytes out. And if you get crampy feeling in the legs, call the doctor, okay? I want to go over some diet information and then we'll be done. So skip over to page 34, okay? Eating and healing during your time of recovery. And this is really important to get those calories in, get that, that nutrition. It's very common, we're on page 34, for the patient to not be hungry after surgery. They don't want to eat, nothing tastes well. Part of that's the anesthesia, makes it so nothing tastes good, and they're just not hungry. Now, we want to make sure the patient eats, so because it's hard to eat a lot, we recommend small, frequent meals. So try to offer food every 2 to 3 hours. We do recommend that they have protein at every meal or snack. Protein will help the wound heal also, okay? So the protein, we would like that lean protein, and you can have some beef. The lean beef would be top sirloin or round steak. There's a lot of good iron in there. Maybe a couple times a week. You could have chicken without the skin. The skin's going to have the fat, but you can have chicken. And you could have some ground turkey. Fish, salmon, and tuna are heart-healthy fish, but you could also have white fish that are low in saturated fat. And so try to have protein. The other proteins that are good are nuts, unsalted nuts, and we also like you to have beans. Beans are a really good protein. Beans have a lot of fiber, and so beans are really good too. Now you could have eggs. We recommend 3 to 4 real eggs a week. The yolk, the yellow part, is what's got the cholesterol that we're going to try to decrease, but the patient can have egg beaters or egg whites, okay? And so You'll see some ideas down here, peanut butter on crackers or celery. The other good protein, possibly if you guys like hummus spread, you could put that on some crackers or some vegetables. Add lean beef or poultry to soups, pasta dishes, and casseroles. We do like the patient to have some dairy products if you can, to get the calcium to help the bone heal. If you do dairy, do low-fat dairy, non-fat dairy, light cheeses, that's fine. Mozzarella, Swiss, some of the light cheeses are okay. Low-fat yogurt, okay? Now, the other thing that patients do like at this time is cold things, because they had the tubes in their throat. They like cold things on their throat. So you can do milkshakes, smoothies, popsicles, Jell-O. Do try to keep these low sugar, especially if someone has diabetes. But you could do all fruit smoothie, maybe add a little protein powder in there. You can also do protein shakes or drinks like Ensure or Glucerna for those with diabetes to get some extra calories in. So number 2 on page 35 talks about getting those calories in. And go ahead and have some light cream cheese on a little bagel, you know. Dried fruit, raisins. We also recommend whole grains. You guys have heard about whole grains. They have more nutrients and fiber. Those are the brown rice, the wild rice, the oatmeal, the whole wheat bread. Those are going to be good, especially it says vitamin C. We want the patient to have a lot of fruits and vegetables. Ideal is fresh and then frozen, and try to stay away from the canned vegetables because they're higher in salt, okay? And zinc is needed for healing. That's in a lot of the things we're already eating, okay? The meats and the fortified cereals, whole grains, and the low-fat, non-fat dairy products, dried beans and nuts. Okay, so nuts are a good snack too. Just make sure they're unsalted. Real quick, I want to point out the salt part, and you'll have to read the diet info in detail. But on page 31, it does talk about cutting the salt. And if you watch anything about your diet right now, the salt would be important. So we want to have low sodium. It's about 1,500 milligrams a day. Do your best. And try to stay away from canned soups or things that are processed, like processed meats that are high in salt, or things that come in a box, you know, in the frozen section. Those tend to be saltier. Also, takeout, you know, tends to be salty, you know, if you're eating out. So think about that as you are healing. Try to have more fresh, okay? Now, you can use spice. You can use pepper. You can use spicy stuff. Just make sure it has no salt. You know, and they have a lot of herbs out there now that are just herbs, okay? Garlic, onion powder, those are good choices. Do not use a salt substitute that says Morton salt substitute, because it has the potassium in it and it can upset your electrolyte balance. So instead you can use Mrs. Dash or seasonings without salt, okay? Now go back to page 35. Things to consider: fluid intake. We do want to drink water as we're healing, and that will help flush the system out. So we do recommend 8 cups of water a day, and trying to do that, okay? So encourage the water. On page 36 is caffeine intake. We recommend against caffeine because it is a stimulant. It can raise your heart rate and blood pressure. So you can do decaf coffee, decaf tea, herbal tea, decaf sodas, and make sure that you avoid the caffeine for a month or 2. Talk to your doctor about when you can resume caffeine if you like that, okay? And same thing with alcohol. That's number 3 there. Do not resume alcohol until you check with your doctor. Usually it's about a month. Talk with the cardiologist. We want to make sure you're done with the pain pills, okay? And so then once you resume alcohol, stick with the recommended servings, okay? And you'll see number 4 there, liquid supplements. You can do instant breakfast, Ensure, to help supplement the calorie intake, okay? So when you cook, fresh is best. Try to bake, broil, saute, barbecue your meats so that they're leaner and not deep fried. Try to use more of the olive oils, canola oils instead of the butter and lard when you're cooking. And then make sure with the diet to go ahead and take some of the classes. We have our class here. Kaiser has a lot of educational classes for diet. In this book, we've included some recipes in the back, or not recipes, but some cookbooks in the back also, okay? All right. We are done. Do you guys have any questions?
I think my only question was that she can't take her probiotics.
The question is if you can take probiotics, and I know that is popular right now to do that, so that would be something you'd have to check with the doctor before leaving, okay? All right, any other questions? All right, thank you guys.